Hi, my name is Kennedy Shelby, and I am a graduate student at Oklahoma State University Center for Health Sciences. I served as a Rural Scholar this past summer in Tillman County, Oklahoma. I'm excited to share with you my research regarding telemedicine implementation. My research mentor is Dr. Mark Woodring. My research is titled The Impact of TeleEMS Post-Hospital Closure in Tillman County, Oklahoma. Our mission was to provide resources for Tillman County that will help overcome the disparities that rural residents face in emergency care. Our overall goal is to yield more positive health outcomes through the use of emergency virtual consultations with ER physicians and to advocate for health equity in underserved areas. To provide you a little background, in 2016, Tillman County's hospital closed its inpatient unit and emergency room department. Out of all the closures in the country since 2005, the Tillman County's hospital closure resulted in having one of the farthest nearest hospitals, with a distance of greater than 30 miles away. In addition, Tillman County is a USDA persistently impoverished county facing significant health disparities. During the summer of 2020, a researcher spent 2 months gaining EMS perspectives on telemedicine use among EMS. With the research that the researchers gathered in 2020, we decided to implement a 2021 pilot study that was initiated to gain a better understanding of emergency needs of Tillman County. This pilot study consisted of implementing tablets inside of 2 ambulances. These tablets allowed OSU Medical Center emergency room physicians to connect to Tillman County EMS through Zoom via AT&T FirstNet. My research consisted of a qualitative data approach that was taken and IRB protocols were established and followed. I conducted semi-structured interviews with EMS personnel post-intervention of the TeleEMS connection to OSU Medical Center ER this past summer. Also, I conducted interdisciplinary focus groups composed of community leaders. Both the interviews that were semi-structured and the interdisciplinary focus group had the purpose of gaining perspectives on how telemedicine had positively impacted them thus far and how we could continue to help reduce disparities in Tillman County. Interviews were recorded, transcribed, and analyzed using a qualitative approach, open and axial coding of data using in vivo. Also, data regarding TeleEMS use was collected. The main factors we looked at was if the tablet was beneficial, the length of the call, the reason for calling, and the call quality. Also, we analyzed all poor connection areas. In any area that had poor connection, we located the area and sent the location to FirstNet. Finalization of broadband connectivity data was also gathered, and I also got the opportunity to observe daily proceedings among EMS as I got to ride along in the ambulance and help run the tablet and help where else I was needed. So after the research this summer, we have continued to do research in this area, and data is being collected from the research, and we are submitting for a peer-reviewed publication currently. Also, OSU Center for Rural Health received a community wellness grant through TeleGen, which has allowed us to continue our TeleEMS connectivity and policy research in Tillman County for another 12 months. OSU Center for Rural Health has recently partnered with Voice, a language translation service, to install real-time virtual translation assistance along with the emergency physician. In conclusion, the opportunity to witness firsthand what occurs during ambulance transport was greatly beneficial to me as a rural scholar. I gained better insight on how essential EMS personnel are in achieving a positive health outcome, especially in a rural area. My time with Tillman County EMS enhanced my passion for rural medicine and made me excited to see how the Rural Renewal Initiative continues to positively impact rural Oklahoma. OSU Center for Rural Health and OSU Rural Renewal Initiative will continue to work to find innovative ways to reduce inequalities in rural emergency care. I would like to thank those listed below, and I'm excited to answer questions that you might have for me in the discussion later. Thank you.